Good afternoon, everyone, and welcome to the WMC informational session on the Rescission of Proclamation 2032. Today we have Marissa Courtney and Emma Marienthal with us. They're going to be walking us through the changes that are happening on October 27th. If you have any questions along the way, please feel free to use the question function in your webinar portal. You can also use the chat function if that works better, and you can raise your hand and I can call on you at the end of the presentation if need be. Now, with that out of the way, take it away, Marissa.
Thank you, Jimmy. Welcome, everyone. This is our presentation on the rescission of the Proclamation 2032, waivers ending and CMEs required being reinstated. My name is Marissa Courtney, and I have my licensing lead, Emma Marienthal, and we're going to go ahead and start our presentation. Just to give you a little background information, the CME requirements were suspended as of March 2020 during the pandemic by the governor's proclamation. These emergency orders will expire on October 27th. So that means on effective October 22nd of 2022, the following pre-COVID requirements will all return. We have our physician assistants who will need to have the practice agreements be required again, and that means also adhering to the physician supervision ratios. Currently, or previously, before the pandemic, that was actually a 5-to-1, and now that has changed to 10-to-1, just due to rules changing during the pandemic as well. And we'll go over that a little bit more in our next slides. And then we also have the limited license holders will have the restrictions regarding geographic locations and some of the jobs described in their appointments. The retired active MDs and PA licenses will have those restrictions back on of their licenses pertaining to the receiving or not receiving compensation for any healthcare services and only practicing in emergent and intermittent circumstances. So that's just kind of what you could be expecting or will be expecting as of October 27th. Like I had mentioned previously in the practice agreement requirements with the PAs, all practice agreements must be filed with the WMC. We no longer approve the practice agreements. You only need to file the agreements with us. We actually created a online portal that's been in place since January of 2020 that is very handy, and we can provide you with the links later on if you have questions. But it is available on our website, and this allows you to actually fill in information and modify information pertaining to a practice agreement, and it's submitted online, and you actually would be emailed a PDF version of that practice agreement, and it also comes directly to us for us to file. So it's very handy, very resourceful, and very quick. Supervising physicians can now supervise up to 10, like I had stated previously. If you have a need for more PAs to be supervised under one physician, MD or DO, certainly feel free to contact us directly, and we can go over the process to have the commission approve more supervision with one MD or DO. And to highlight, the remote site supervision waiver is no longer a requirement. We no longer need or require you to provide us with a remote site supervision plan. It's non-existent now. So you can just fill out a delegation agreement, tell us how your supervisor, or if you're supervising, tell us how you're going to be supervising, and that will be enough for us. So I will go ahead and move it on to Emma.
Perfect. Thank you so much, Marissa. Lots of good information to go over. Like we previously talked about, this announcement by Governor Inslee was at the end of July. So that left all of August, all of September, and the better part of October figuring out what we would need to do here at the commission, and then leaving our providers, our MDs and our PAs, how they would after not having the requirement for their CME hours for the last 2.5 years, what that would kind of look like all of a sudden in the next 3 months. So the commission got together and really wanted to game plan to make sure that this transitioned back into how our requirements were previously prior to the pandemic, how that would look for our providers that would be affected immediately after October 27th. So the commission will officially be instating a grace period for all of our MDs and our PAs to make sure that they have ample time to either get caught back up or have enough time to complete in full whatever is left in their out of 200 hours, what they still need to complete. So this will be officially starting the day after October 28th. So any MD providers from October 28th to December 31st, if you look on your renewal notice, or if you give us a call or send us an email and you see that your CME due date falls in between this date period, as of October 28th, those dates will now not be due for their CE hours until your birthday in 2026. So because all MD credentials are on that 2-year renewal notice, we're going to give you that full 2 renewal times to make sure that all of those hours are caught up with, so that you're not scrambling between now and the end of October to get those caught up with. And then going into next year, giving you that full 1-year period to get those done. So anyone that's an MD that has those hours due between January 1st to October 27th, which will take us to that 1-year mark of this being back in action. Your CMEs are now not due until your birthday in 2027. And this is just for credential holders that have that MD credential. We'll go into the PA extension in a little bit further into this presentation. And then just to give everyone a little bit more of a visual example of what this would look like, as you can see, if your CME attestation is due November 13th of this year, now, as of October 28th of this year, it's not due until November 13th, 2026. So we're giving you that additional renewal period to get those all caught up. Going into next year, if your CME attestation is not due until your birthday in 2023, now it's not due until your birthday in 2027. Once we get to that 1 full year of having this extension in place, as it states, if your CME attestation is due anytime after October 27th, 2023, so in this case, it's November 1st, 2023, that extension has been completed, that 12-month period extension is done, and your CME hours will still be due on that November 1st, 2023 date.
And that kind of leads into PAs as well. We have laid out a table that shows you kind of exactly what Emma was going through, but because our PAs report their CME hours every renewal or every 2 years, we just did one that is more it's more house for PAs. So as you can see here, for October 28th through December 31st of 2020, anyone with CMEs that reflect that are due during that time, we're going to waive your CMEs until your birthday of 2024. And then piggybacking on what Emma said, again, for those who have their CMEs due next year, from January 1st to October 27th of 2023, your CMEs are now going to be reported in 2025. Obviously, for our PAs, if you hold your NCCPA certification, that is going to already bypass you for your CMEs. But for those who are not certified currently, you would be required to do your 100-hour CMEs by either of these dates. So just to show you that table, and again, kind of the example to show you, we have, if a provider has their CME attestation due on December 1st of this year, they're now, the CMEs are now due on December 1st of 2024. If we have another provider who has their CMEs due on June 26th of 2023, they now have that 2-year grace period and extension, and now will report on June 26th, 2025. And as Emma had mentioned, for those who are outside of that 12-month window, you're still given a year, plus again, for our PAs who are certified, you already meet the requirement. But for those who are not certified and have not, you have a year from now to get your CMEs completed. So for this person, this example, their CMEs are due October 29th, 2023. They would unfortunately still be due on October 29th, 2023, but again, we're giving you over a year to get prepared for that. And please let us know, if that is something that you cannot obtain, and we can go over the next process with you.
So what this waiver process would look like, in the event that you get up to your renewal date and you are looking through your documentation and you're unable to complete your CME requirements by the extension dates that we've provided in this presentation and that are listed on the Commission's licensing page for you to reference, the Commission has been able to approve a one-time extension. You can't use this multiple times, but just please send us an email to medical.licensing, and just basically, like it states, doesn't have to be anything fancy or nothing, we don't need an essay or anything like that, because this is ultimately a tool to help you as the provider out. We would just need your name, your license number, and a way to contact you to make sure that we are getting you up-to-date information as best as we can. We'd like to know where you are currently employed or where you're currently supervising your physician assistants, and then just a brief explanation of the circumstances that are preventing you from completing the CME. A lot of people are going through staffing shortages, what may have, but whatever we can do to implement this extension for you, just give us some brief information to allow us to do that. And then we just ask, if possible, just so that in the case that we get a high volume of these extension requests, we want to make sure that we're processing these just as quickly as we can. We do request that these waiver extensions be received by at least 30 days prior to your CME attestation due date. And that can be emailed to us like we've stated. You can also mail it in, but that might factor in mail time and might not get to us in a timely manner. So it does appear that emailing those requests would be as fast for you as it would be for us.
Thank you, Emma. Mm-hmm. All right, so just to go over some FAQs with you. We have CMEs that were completed during the pandemic or proclamation timeframe are still valid. We have been receiving a lot of inquiries about that recently. You do not need to complete a new set of CME hours towards your required CMEs once the proclamation expires. So those that you've taken during this time still are valid, and you can keep those for your record. That just goes into the next bullet point, which states that you do not need to provide us physical copies. The only time we'll ask you for those if you are either audited or you are submitting your reactivation application to reinstate your medical license. So we will not ask you for physical proof unless we contact you directly and ask for those. So in the meantime, just keep that in your own personal record and keep track of it. And then once we are done with your renewal, you can house it for however you like. But for the meantime, we will not require you to actually mail in or email us proof. Lastly, if you are planning to renew your license through the mail or manually renew, please note somewhere on your renewal notice or with your check that you're taking advantage of the CME extension waiver, just so we have that matching up with our records. So again, typically we are looking for that email from you to the medical.licensing@wmc.wa.gov email address, and we will put a note in your account or file letting us know that you're taking part in the extension, and then once we receive your actual renewal, we will match that up. Now, if you're renewing online, that's not going to affect you at all. Everything just moves smoothly with that. So it automatically makes you eligible for the extension. So now we have concluded our presentation, and we are now available for questions if you have any.
Absolutely.
Thank you so much, ladies. Go ahead and feel free to type your question into the question box while folks are typing in. We did receive a couple questions. The first one being, will these new CME attestation due dates be reflected on the provider license lookup webpage, or is there somewhere else to look for the new dates?
Certainly. So unfortunately, our system will not be able to reflect that, so it's not going to show on our provider credential search or on the renewal notices that have gone out or will go out. But we are having this on our website. So we have numerous places where we can provide you with the links to show that. It'll have the tables for you to reference. And certainly you can always give us a call or send us an email just to double check to see if your CMEs are due. We are very happy to assist with that, and can clarify any questions that you may have with whether or not your CMEs are due, or if you need an extension if necessary.
Mm-hmm.
And then someone asked, will the NCCPA respect these new deadlines for CMEs?
No. So the NCCPA certification is completely separate from us. That is something that you have to complete within your time frame with the NCCPA. We just use that certification for your CME hours for us. So in lieu of the 100-hour requirement, if you are NCCPA certified, we just look you up and validate that your certification is still valid and up to date. And if it is, we move you along in the renewal process. For some reason, if you don't sign your attestation, or if you stated that you did not complete the 100-hour requirement, we look you up and see if your certification is valid, and that counts. So it is completely separate. They're not going to be notified of this extension because it does not pertain to them. It's only with the commission.
And then we have a question about, what about MDs who renew through the Interstate Compact?
Do you want to take that over, or you want me?
Same process, correct?
Mm-hmm.
Yeah. So same process, you would only be allowed to still renew through their imlcc.org website, but same process, because we'll be the ones ultimately changing your status from active and renewal to physically active. So you can still email the commission that you are taking a part in this CME extension, and absolutely still reach out to us if you do need to request that waiver. That medical.licensing@wmc.wa.gov would still be the best place to send in that request. But we'll definitely, even if you're an interstate medical licensor license holder, we'll definitely still be able to take care of you in that aspect. Great question.
And then someone said that they missed the beginning about the PA MD supervisor requirement. They were wondering if you could go back and repeat that bit.
Sure. So we basically, what we were talking about in the beginning of the presentation is that with the proclamation ending, it now is requiring for PAs and MDs to submit their practice agreement when entering into a new supervision. Now, a lot of our providers and entities have actually been continually providing us with those agreements. there may be just a small amount that took advantage of the proclamation, which was in your right to do. But a lot of providers were already submitting a new practice agreement every time that they switched a supervisor or had any changes to their supervision plan. So we would just require now, as of October 27th going forward, that if a PA, MD, or DO enters into a new supervision, that they actually submit a practice agreement to us. Again, that's something that the commission is not approving. We will just file in-house those agreements on file for both the PA, MD, or DO, now that that's a new added benefit with our PAs in supervision. But that is something that we will require as of the 27th. So we have a great online portal, and I can go back and or we can send you a link if you provide us with your email address. We can send you a link in the email and email you information regarding the new practice agreements and the new updated changes that recently happened last year with adding the DOs as a supervisor as well.
And then we have someone who has a retired MD license. They're still active for volunteering at a clinic. They're wondering, do I still have the 200-hour CME requirement?
So do you want to take that over? I'm sorry.
No, you're fine. So the retired active status, they, as they know, report their hours at every renewal, not every other renewal. So they would still fall under this extension, or if they still like to request that waiver process, we'll definitely be able to extend that to that credential as well.
Yeah, and to just piggyback on what Emma said, so with our retired active providers, or at least our MDs, they report every renewal cycle. So that means they only report every 100 hours for every 2 years instead of the 200 for every 4. So like Emma stated, if you need an additional time to get those CMEs completed, certainly feel free to contact us with the email address listed on the screen, and we'll be able to grant you that extension. So we'll be able to assist you no matter what. Any other questions, Jimmy?
Just kind of looking. Okay, so there's not sure you'll be able to help, but well, let's just try. How do we provide a current NCCPA certification to the commission? Is there somewhere it can be uploaded, or do we email it?
Email.
Yes.
Yeah.
Email is preferred. There isn't a spot for you to upload anything to us, but we also have access to the NCCPA. So if you even just email us and state that you are currently certified, our renewal specialist will be able to log into our portal with the certification and double check your credentials. So either way, we will be able to get that information verified for you.
So there's someone here, I'm not sure of the license type, but it says my CME is due on 1/20/23. So the 100 hours are not due until 2025. So in 2025, will I need to accrue 200 hours or just the 100?
Just the 100. We're not going to ask you to accrue what was already waived. Mm-hmm. So you're just going to focus on your new requirements as of 2023 going forward, or you can even start accruing, now, and then you will not need to report those hours until 2025.
Well, that is all the questions we have in the question box. Thank you so much, ladies. If there are other questions that our attendees think of later, you can always email medical.commission@wmc.wa.gov or medical.licensing@wmc.wa.gov. And I would just like to thank everyone for attending and paying attention. And thank you so much, ladies, for all the helpful information.
Thank you so
Jimmy.
much.
We appreciate it.
Take care, everyone.
Have a great day.
Thank you.